So I have a specific focus on how to reduce X-ray exposure and contrast media volume in my daily practice, because I've been doing complex endovascular procedures for now more than 15 years, and I have a real concern regarding this exposure to radiation. So the way we've dealt with that is to use advanced imaging technologies such as fusion imaging. And so we use fusion, we avoid magnification, we do a lot of collimation, and on top of that, because we use fusion, it has reduced significantly the volume of contrast we need to inject to perform those cases. So the answer is really yes, and I think any tool that can help us to reduce even more radiation and even more contrast volume should be considered. I think that the real interest in the blood flow sensor will probably be for those undergoing the learning curve using fenestrated and branch endograft, those complex endograft. There's a real concern when you start doing those procedures that technical success might be an issue. So using this cerebral sheath with the sensor will actually help you nicely position the endograft, making sure the fenestrations are nicely positioned, and then have a stable platform to access the target vessel. So I think there's going to be a huge benefit of this cerebral sheath and the sensor combined together to perform those complex cases. One of the issues we have when performing those complex cases is that it can sometimes be very time consuming, and then you have sheaths and catheter against the aortic wall. And most of those patients have diseased aortic wall, and some of them we have what they call shaggy aorta. And if there's a conflict between the sheath, the catheter and the wire and this shaggy aortic wall, you can have cholesterol emboli going to the visceral vessels, to the lower limbs, and this can be a catastrophe. So I think if we can stay in the aortic lumen and have this cerebral sheath with the sensor telling us in which direction we can directly go to the target vessel, then obviously this will be a huge benefit to our patients.